Okay, so thank you everyone once again. Welcome to the, I've lost how many we've done now, several numbers of webinars now that we've done over the last few 6 to 8 weeks. This one is in conjunction with Sutton Coldfield Chamber of Commerce and Lichfield and Tamworth Chamber of Commerce. My name's Chris Fullerton, I have in both of these areas. And today it's a great pleasure to be welcoming our two chosen charities for our chambers. So we have YMCA Sutton Coldfield, who are our Sutton Coldfield chosen charity, and St Giles Hospice, who are our Lichfield and Tamworth chosen charity. The process is a vote across all of our members every couple of years, and we really are excited and enjoying working with two really important causes across what is a very important sector, certainly in the current time. I wanted to first introduce both speakers. So we have, firstly from YMCA, Deputy CEO Stephanie Bradbury. Stephanie has spent 19 years at YMCA and works along the management of services, developing new business and supporting the CEO with governance. And we also have Dr. Emma Hodges, who has been at St Giles Hospice for 10 years as Chief Executive for 4 of those, and covers hospice care, fundraising and retail. The sort of the reason and the subject of today's webinar is very much around really shining a light on two vitally important organisations with really strong connections across our districts in Sutton and Tamworth and beyond in some cases. Really looking at the business challenges, some of the fundraising challenges and successes they've had, and how really charities have adapted to our changing times. So thanks everyone for coming on board. You'll see on the right hand side there's a chat box for you to answer your questions. You'll see Jess, who is in the background running our webinar today from the Chamber's events team. If you've got any technical issues, please put the comments in there. As is usually the way, if you have got any issues, we would suggest you log in and log out again. As always, that normally sorts any problems with sound or video. Any questions, please put in the chat box. We'll have a Q&A following both presentations. Make sure the sound's enabled on your speakers. Use Chrome instead of Internet Explorer if possible. And yeah, we really look forward to an engaging discussion today. So without further ado, it's great to be able to welcome our first speaker today, who is, I said, Dr. Emma Hodges from St Giles Hospice. Emma, I will pass over to you. Just a quick note for those on the those delegates on the call. Please take notes, please ask questions, and following both Stephanie's and Emma's presentation, we'll have a Q&A and discuss some of the themes raised. So, Emma, pleasure, and over to you. Thank you.
Thank you, Chris. And thank you, everybody, for signing in and joining this webinar. It's great to have the opportunity to talk about the challenges we've faced through the pandemic. I'm just going to talk about that in 3 phases, pre-COVID, and then the chaos as the phasing and certainly some of the challenges started to show, and then starting to think about the future. So just in terms of background, for those that don't know the hospice so well, we're a 14.5 million turnover charity. We spend about 10 million on care, and we get 1/3 of our funding from the NHS. So everything else is raised through fundraising, through retail and through lottery. We have about 404 employees and over 1,200 volunteers as part of our workforce across the shops and the hospice, and we serve a population of about 850,000. And we're supporting about 1,500 patients across all of our services at any one time. Our clinical services, inpatient beds across 2 units, community nurses, hospice at home, bereavement support, day hospice, groups that we've supported face-to-face for people living with a long-term palliative condition, as well as providing support for people at the end of their life. We obviously started to think about the challenges that we would face as COVID started to arise, and we were all, as you will have all been watching the news and thinking about the consequences for us as an organisation. Prior to lockdown, we'd already had to cease face-to-face patient activity on site. So we'd stopped day hospice, we'd stopped our clinic activity. And we were very good in that the nursing teams for those 2 services transferred to our ward and community nursing, so that we were able to continue those services whilst being concerned, of course, around sickness absence of staff. So during the crisis, we've been able to keep both inpatient units running. Our community nurses have been out and about visiting where it's critical, but a lot of telephone and video conference support. Hospice at Home have still been going into people's houses in the last 2 weeks of life to support people to die at home if that's been their wish. And everything else pretty much has had to move to digital means. 24/7 advice service. Our bereavement help points have been using Zoom. We've helped people in their 80s use Zoom for the first time and connect so that we can manage and support people through what has been a very isolating period for them. Some of the challenges for us as a business have been that we spend about 800,000 per month. And as you heard, most of that is generated through voluntary means. And our voluntary income just dropped off a cliff. You know, shops had to close, fundraising had to cease and move online as best as possible. And there were times in the early part of the crisis, just at that same time as lockdown, but before the employment measures were announced, that we honestly didn't know whether we would survive the year, that we were having conversations about how would we potentially mothball the charity to enable us to reopen in the future, rather than use all of our assets now through a crisis and not survive. So we really didn't know that we would be able to survive this pandemic at all. The employment measures, when they were announced, over that weekend, because they were announced on the Friday, so over that weekend, we categorised different staff. So we've got essential key workers who have continued to work throughout. Our retail staff, at that point, we were thinking, how would we keep people productive but working from home or off-site? But the furloughing has really been one of the key measures that saved our charity. And we furloughed about 100 staff the first couple of days after that announcement, and we now have 173 staff furloughed, mostly from retail and a few other posts that we've furloughed. And that's just been phenomenal in supporting us. We have a means of staying in touch with everybody that we've been supporting, and also in touch with all of our staff and volunteers to ensure that they're kept up to date with what's happening and they feel involved. And I have a Zoom call fortnightly with our furloughed staff and working from home staff, and I have about 67 people who turn up for that. So we've tried to keep everybody connected. We had significant challenges around PPE. I had to do a public appeal in the end to try and get sufficient PPE for our key workers, and you'll be aware of some of the challenges around that nationally. We also then had an announcement of government support dedicated for hospices, and that has been the second plank of funding that has supported the sustainability of St Giles. Despite that, we still need to raise £300,000 a month through voluntary sources. Our fundraising and marketing team have been phenomenal at moving things online, because a lot of the face-to-face fundraising and events we've had to stop, obviously. We've had so much warmth and support from our community. They've been phenomenal, and we've been able to keep some of that money coming in. Pre-COVID, in fact, the week before lockdown, we were sat as an SMT talking about how we would manage the rising costs of care, the fact that we can't afford to pay the same salaries to our nurses as the NHS, the fact that we had a deficit. So we were already talking about how we would have to change our shape as an organisation. As we start to come through the other end of this crisis and we start to see things settling down, although of course we're all concerned about a second wave and the impact on services and staff, we're starting to be able to plan what the NHS are calling recovery and restoration. So we're using that language because we have to report back to the NHS what we're doing. So we're able to start to plan how we're going to adapt our site and our services, how we're going to start to think about retail and the phasing of the opening of shops, and the balance, I suppose, that we have to take in terms of footfall on the high street and income from shops v furlough for as long as it lasts. So that's some of the balance that we're considering. We've moved some of our services digitally, and certainly the NHS is still going with a digital first strategy. So video conferencing will need to ensure that our IT facilities are able to meet those changes as we come out of this crisis. We hope that the government's funding will continue for as long as it takes to allow non-statutory income to recover. I'm not hopeful that it will recover to the lengths that it did previously. I think shopping habits will have changed. They were changing anyway. So we are concerned. We will continue to advocate for increases in statutory funding. The NHS was supposed to be free for cradle to grave, and for critical services delivered by nurses and doctors to be funded at about 36% isn't a sustainable position. So we hope that the fragility of the hospice sector has been shown through this crisis, and that perhaps we'll be able to access more government funding going forwards, but we have no guarantees on that. So we have to work really hard at our non-statutory income lines and getting them up and running as fast as we possibly can. Our key workers have been incredible, and their resilience, their dedication in order to ensure that we've been able to continue to keep those services open. We had periods of time when our occupancy on our units was at 100%. The number of people that we were seeing has increased. The number of people coming to us quite late on and dying quite quickly has also increased. So the mental strain and psychological well-being of our staff is a concern as this moves forwards. And we're working quite hard now to look at what are some of those bereavement services, psychological well-being, occupational health. How do we access some of those for our teams at a more enhanced level than we have? And also we're working with partners around the increase in bereavement support that's needed out in the community. And that will be offered via a video conference, some face-to-face, and via telephone. So we're really focusing on the sustainability of the charity for the future, but also the needs of our communities and how do we meet those needs in a very different way. So that's my 10 minutes. Hopefully that's given you a little bit of insight into our challenges through COVID, and it'd be good to take questions later after Stephanie's had her 10 minutes talk. Thank you, Chris, back to you.
Thank you, Emma. Brilliant. Thank you. And I think, it really sort of shines a light, doesn't it, on some of the struggles and issues. There was a piece on the news last night about hospitals and the psychological strain on staff, and I think that's really quite clear, and something I'm sure we'll come back on after Stephanie's presentation. So Emma, thank you very much. So over to you, Stephanie. So from just as a quick intro again, so Stephanie is from YMCA Sutton Coldfield, our chosen charity in Sutton, and I know a very active fundraising arm is vital to your charity, and I'm sure you will have come across some various challenges and successes. So Stephanie, over to you, and look forward to hearing what you've got to say. Thank you.
Thank you, Chris. I think, as Emma has said, thanks for the opportunity to share with everybody what's happening here at the YMCA in Sutton. And we have had some really similar challenges, I'm sure, as you'd expect. We're a smaller charity. We're quite a grassroots charity. We have just over £1 million turnover each year, and we have a staff team of approximately 35 people who are part-time and full-time. A little bit of background about what we do. Often people associate YMCA only with hostel work. So just to give you an overview of what we actually deliver, we do have a 42-bed hostel here in Sutton Coldfield, and at present we've got 34 residents that are 16 to 30, all self-isolating on the site here. But we also have a wide range of youth and children's work. We work with children from 5 upwards. All of them are from disadvantaged in one way or another. So we have our young carers service. We work with over 150 young carers, 5 to 25 every year. We also have a variety of youth work, and the youth work that we deliver is for 10 to 19-year-olds in really economically disadvantaged areas. We've got a large presence on Falcon Lunch, and we deliver a wide range of services. We've got youth clubs, we have detached youth workers out working with young people, we do family work, lots of one-to-one, we have life coaching, more focus work around mental health, physical activity. We also have our children's work, so we work with 5 to 10-year-olds. Our children's work, again, in one area is focused in very disadvantaged communities, where we're supporting children that are often at risk in different ways through play therapy and play work. And we also do have our own trade-in opportunities with our play scheme, which is for working parents. And finally, we have our disability work, and we work with young people from 10 upwards who have moderate to severe learning disabilities, and that forms quite a large part of our work. We deliver day services 5 days a week for young adults 18 and over with life skills. We have our short breaks, which is respite for parents and families who have children that have got profound and multiple learning disabilities and also have underlying health issues on top of that. And of course, we're operating on the weekend, so we're delivering youth clubs for our young people with disability services. So of course, quite obviously, the immediate impact of the pandemic has been that most of our work is face-to-face. So straight away, in the same way as Emma described, we were thrown into chaos, and all of our staff were immediately, apart from our hostel staff, were working remotely from home, and we had to come up with some really creative ways of trying to maintain support with our beneficiaries who are already disadvantaged, and the pandemic was only going to make that disadvantage felt even more amongst the families. So we've been delivering things like Zoom youth clubs. We've been supporting our young people through video conference calls. We've been working with the families. We've done lots of different activities using social media apps. I think it's been one of the plus sides of the pandemic is we've really embraced social media and remote working, and some young people really like that. Parents maybe not so much, so much more around phone calls, checking that people are okay, providing activities, and also seeing that everybody is safe and well. So I think in a very similar way as Emma described, that there was also challenges with remote working, and for a very small charity, we just don't have the capacity to even do something as simple as provide everybody with a laptop. So we've been relying heavily on staff's goodwill and using their own personal laptops and phones. We haven't got things like Microsoft 360, so it has proved quite challenging in its own ways, although we have been able to use things like Zoom to maintain contact with our staff. Straight away, we was really concerned about our contracts in terms of our income. Approximately, 50% of our income is coming from grants and trusts, fundraising activities, and contracts. So we had to spend quite a bit of time renegotiating our contracts with people like Big Lottery and Children in Need, Comic Relief, to gain permission to deliver it in a different way. And we're really fortunate that they've been extremely supportive in helping us do this. However, of course, the income that we've relied on from our fundraising activities, all of our events have had to be suspended, and we've felt the immediate hit of that, and foreseeable for the rest of the year. Money that we was relying on now, we're really considering other ways of where we're going to find that money. And of course, there's the uncertainty of when we will be able to recommence our fundraising events and activities to help us to support that income. I think what we're seeing on the ground, what we are seeing with our beneficiaries is a huge amount of crisis. Our families that maybe were quite reasonably stable are escalating rapidly to crisis point now. Our staff, we've moved very much from a preventative service to more of a crisis management service. We're seeing much of our work is around safeguarding. So we've had over 100% increase in safeguarding referrals and concerns that staff are picking up around families. Huge amount of food poverty. Literally, families are not having they're not having the means to feed everybody in the house. We've got multi-occupancy families. There might be up to 10 people in a flat with parents that maybe have already had problems with substance or alcohol misuse, and those problems are escalating. And we're supporting the children and young people in the house through the pandemic who are anxious. There's issues surrounding those problems in themselves that we're trying to deal with. So when we are going out, we are actually going out to families. We are having to go and do doorstop checks using social distancing just to see that children and young people are safe and well, to see that they're all right, because what we have found when we do make referrals to social services, unfortunately, social services are still working quite remotely from home, so they're unable to do those doorstop checks to make sure that that there's not a serious concern with a child or a family. And as schools have been closed, they're also not picking up those kinds of issues. So I think, again, as Emma mentioned, that's had quite a large impact on staff, and there's been a lot of offloading on each other, and again using those remote video conferencing calls to be able to discuss cases and support each other. In the same way, we've also furloughed 17 of our 35 staff, which has had a huge impact on our capacity. Most importantly, I think, on our senior leadership team, which is just myself and the CEO. So when we haven't got a fundraiser, we haven't got a bid writer, we haven't got a HR person, and our marketing person, unfortunately, we've had to furlough as well. So there's been quite a lot of plate spinning for myself and the CEO, and trying to keep up with the constantly changing environment that we're faced with. And moving forward, what we have found in terms of funding, the grants and trusts are very much focused on short-term COVID-19 responses, which is fantastic, and we are tapping into that, but it's also creating a huge amount of uncertainty for any long-term planning post-pandemic. And we're now considering how we will have to change and most likely reduce our services in the longer term scenarios. So it's been quite challenging knowing that families' need is escalating, and yet we're probably going to be less likely to be able to support them. Moving forward in the short term, we are remaining as agile as possible. We are totally needs-led. We're listening to what families and children are saying on the ground. If it needs to be done, we're doing our best to do it, and our staff have been incredible to support us in that. And most importantly, talking to people like you to make sure that people are engaged with the work that we're doing, people are aware of challenges that charities are facing, and not just challenges that charities are facing, also challenges that disadvantaged children and young people are seeing in the local community. So I'll finish there and I'll hand back to Chris. Thank you very much.
Thank you, Stephanie. No, that's great. And I think, yeah, for me, just to sort of have those struggles, but also some of those ways that you've really really changed the way you work is a really positive step. So fantastic. Well, we've got some questions through from the assembled delegates, which is great. Stephanie, Stephanie, if you could just add your video back on if possible, we'll start this Q&A. There we go. Wonderful. So again, I think again having that clear idea, and I think you mentioned, both of you mentioned sort of panic stage, I suppose, when it all did sort of hit, and I suppose the fact that you've got those plans hopefully moving forward means that like many businesses, you've probably gone through a very similar process, but at the end of the day, your sort of service users are obviously much more disadvantaged and much more at risk at various levels. So it's great to hear that you've managed to diversify and are continuing to do that. Right, so we'll get on to the questions. I think there's some really good ones coming through. Continue to ask those questions as we go. I'm just going back up to the top. So so firstly, yes, so Richard Hollins, thanks for a useful webinar. I've been just getting your thoughts on what volunteering might look like in a post-COVID world. Many volunteers are senior citizens that may need to be shielded. Might this change your approach to retaining volunteers? If we go Stephanie first on that one. Stephanie, what do you think on that?
Okay, so many volunteers, senior citizens may need to be shielded. I think for us, our volunteer group is more younger people anyway, because of the nature of the services that we deliver. We're very much of a youth organisation, so we tend to recruit young people as volunteers. So I think that might be a little bit less challenging for us as opposed to maybe for Emma with St Giles. So yeah, probably best that I hand that one over to Emma.
Yeah. Okay, Emma. Yeah, over to you. No, fair point, Emma. What do you think about that?
Yeah, it's a significant risk for us as an organisation. So we have over 1,200 volunteers, and a lot of those volunteers will be in the vulnerable category, if not in the extremely clinically vulnerable category. We're risk assessing both our staff, so staff and volunteers. So we're risk assessing our volunteers and we're risk assessing the environment that they work in. But there will be some areas, so for example, our shops, which we really need to open as soon as we can get some customers in. The fact is a lot of the volunteers are going to be vulnerable and might not want to return back through anxiety, or might not be able to return back through government rules. So we're having to think about which shops can we open based on which ones we can staff. So we will do all we can in terms of risk assessing and thinking about where best to place our volunteers so that they can return, because whilst yes, it will definitely impact our retention, we're also aware that volunteering is a really positive thing for people to do around social isolation. So we need to get a balance of risk there. So yes, big concern, major risk, definitely not going to retain everybody, doing all that we can. And our approach to volunteering in the future is just going to have to be ultra flexible.
Absolutely, and you mentioned about the retail shops. Obviously, that's a key part of your business plan, I suppose, as a fundraising organisation as well. The clarity that's being given now is getting better. Give me your thoughts on how that retail change will happen.
So we've been told 15th of June. So we're going to phase our shop opening based on those that we can be sure that we can put social distancing in place and that we've got staff and volunteers. Donated stock will be touched for 72 hours. PPE will be in place where it's required. So we'll be opening and then making sure that we put in the health and safety measures. What we don't know is we believe that there is a lot of donations waiting. A lot of people have been clearing out their stock, and I'm aware that people are desperate to donate all of their black sacks. So I think we could be inundated with donations, which would be good, although we won't process them all straight away. But it's the footfall. And my concern is that if we go too fast, the furlough gain from the government may be better for us than the income that we'll take through the shops. So we're just weighing that up and going phase by phase.
I think the challenge is the furloughing of staff and that balance, isn't it, between bringing people back on board and and having them sort of in the shops that people aren't going to. I think we mentioned we had Lichfield and Tamworth Council on last Friday, and they were again looking at how shops can reopen and giving that guidelines, but a lot of it comes back to the confidence of staff and of people going out to those shops, doesn't it? I think that's a really key thing. I think it's great to hear that there may well be a spike in people giving out donations and helping with you, and I'm sure all charities will get that, and I think that's probably a really important part of the message, isn't it? Is that you're not closed. There are ways to donate, and there are ways to still fundraise, I think.
So we have 32 shops across our patch, so we've got the ability to phase some of the openings. All I hope is that the donations that are going to come are spread across the 32 shops and not all in the same place at the same time.
You'll need some help on that. Brilliant. Well, thanks both. Next question, please, Jess, if you could put the next question up on the screen. So, hello, Stephanie. We are an educational /charity organisation. If we felt we offered something that might benefit your clients, could we get in touch? I know you've put your email on there. I suppose on a broader point, how important is it going to be working with other educational organisations and other charitable organisations to come together and bring a lot of that support together? Give us a thought on that.
Yeah, I think in terms of partnership working, something that we're massively relying anyway. We already really do try and link up with the other charities in Birmingham. So I think I've just posted my email address. I can pass on my phone number as well. Definitely encouraging any charities that are working in Birmingham and Sutton Coldfield to get in touch to see how they can work with us. One of the huge things that we have seen on the ground is there is just a massive reduction in services for young people and children, and our main aim is to get as much support for those families as possible, and that is done through working in partnership. So happy to pass on my phone number and any other details as well, Chris. That'd be great. Thank you.
Brilliant. Thank you for that question, Penny, and hopefully we can you can help YMCA move forward. Paul Roberts from Keeley's, I think, a star of one of our recent webinars on employment law, and I know on Twitter Paul has been doing a huge amount of the Miles for St Giles campaign. So I think Paul knows, but probably for other local businesses, first to Emma and then to Stephanie, what can local businesses do to support your charity?
So I think there's three key things. Paul does an awful lot for us, and we're very grateful, Paul, as you know. The three things that we would say is that supporting us through charitable events, so being able to do something like Paul does, and any shape or size to do something to get your business together to raise some funds for a charity is always very, very welcomed. I think also there are some common business challenges, and where we can have video conference meetings to share some of those challenges, because they are similar, and sometimes we don't have the breadth of resources to solve them, and we're all solving them separately. So it'd be good when there are specific issues coming forward to have forums to debate and discuss. So they exist, and that would be great, particularly as things move forward. The other thing, which you might not know you can do from us, is that we do support organisations who are dealing with bereavement in the workplace. So we do an understanding loss in the workplace course for businesses, and we also have a bereavement support line that people can access. So if you have teams who are dealing with or impacted by, or you want your organisation to be more confident in supporting people around loss in the workplace, I don't mean loss in the workplace, but loss and the people who are in the workplace, then we already do that for some businesses, and we certainly do quite a lot with schools. We think that's going to be critical moving forwards, and we can do that as a funded service as part of trying to diversify. So if you want to talk to us about courses on understanding loss in the workplace or access bereavement support for your teams, then please get in touch with me.
Okay. Wonderful. Thank you for that question, Paul. And to Stephanie, bringing on that. So from a Sutton YMCA point of view, I know we had the Sleep Easy that was due to take place in the Grace Church Centre. That obviously, I think, was it the Friday of the lockdown as it started. So I know Anita very well, and she you worked hard on that, but it was still managing to change and diversify that plan that seemed to still raise some money. So that was an idea. But yeah, let us know what other areas businesses can do to support Sutton YMCA as well.
Yeah, I think as you mentioned, Chris, Anita really managed to turn that around very quickly, and it was the Sofa Surf event, which was fantastic, and we were very fortunate that people carried on supporting us. And I think from our perspective, it's building on that and trying to just keep engaged with us, keep promoting us. If you're engaged in our social media posts, our young people are posting all the time their stories and what they're doing. So it's really helpful for those to be shared, and be ready to support us when we are able to come back to do our fundraising events, and don't forget about us. I think that would be the huge message from us. And finally, some businesses in certain areas, there is some in-kind kind of sharing that businesses can help us with, depending on what business it is. So there's always that avenue as well, if you feel that you fit in with any of the things that I've talked about today. And certainly with the immediate stuff that we're doing at the moment, which, as I said before, food poverty is massive, and we are finding that clothes poverty with the children is huge as well. A lot of children not having clothes that are fitting anymore. So that's right.
Yeah, I can. With 2 young children myself, I can certainly vouch for that. But I'm sure in certain circumstances that's even more of a difficult situation for young families, isn't it, and growing families as well. On the social media side, obviously you mentioned that was one of the big things that are sort of successes that you found as a business and as a charity is moving a lot of things online. Do you think that's almost sped up what you were planning to do anyway, but this has almost meant you've been forced, for want of a better word, sort of forced into changing? And yeah, give us your thoughts on that first from Stephanie and then to Emma.
We already had one youth project called Virtually Minded, which was online anyway, so that was using social media platforms, and it was reaching out to young people to deliver social media campaigns online via Instagram, Twitter and Facebook. So we'd already had that platform anyway, and from that we've been able to widen it to all of our services. And I think this has been one of the big gains, that more people are engaging back with us now. So that has been a huge boost. And I think post-pandemic, it's something that we'll continue to deliver alongside our face-to-face services. Some people, so for example, young carers, some young carers don't have the opportunity to get out of the house and come to the face-to-face respite services that we deliver. So it has in fact enabled us to reach a wider audience in that way. So I'll pass over to Emma.
Yes, absolutely. Emma, and your thoughts again. I know again it's different size of organisation, but I'm sure similar sort of challenges or successes on social media.
Yeah, I mean, on the income generation side, we've definitely had to move faster to put some of our income generation activities online. We launched an appeal. Kate is our clinical director, and she's worked solid hands-on in Scrubs through this crisis, and we couldn't have got through it without her. So that raised quite a bit of funds quite quickly. Most of that was all social media led and online. So yes, we've done more. We're seeing a lot of warmth and online contact from members of the public who are trying to find alternative ways to support the charity. On the service side, absolutely. When we started to look at this crisis, and when I saw something that suggested some things were going to stop, and I'm like, oh no, they're not stopping. We're just going to do them differently. Do not use the word cancelled and ceased. They're being redesigned, and we were able to move things online. So we have been able to do, as I mentioned earlier, the bereavement support. Our Phoenix Children's Bereavement Service, the support group went online. Multiple sclerosis group has met online. And they're desperate to get back face to face, but we will continue to have an online offer for those for whom it suits most. So yes, sped up that strategy, and we've had to be very, very flexible on how we do that. Digital care is going to be with us for quite some time because of the vulnerability of our service users.
Yeah. Okay. No, thank you, Emma. No, really, really good. And again, yeah, it's interesting. I think every business has had an increase in their digital footprint in one way or another. And I think, yeah, yourselves sound no different. So now that's really, really encouraging. Jess, if we could go on to the other question. We've got about 5 minutes left. So there's a few questions to come now. So from Eleanor, obviously, during the pandemic, there's been an increased need for your services. Are you expecting an increased demand for your services as we move towards relaxing of lockdown measures and get back to a new normal? Emma first. I think you know Eleanor quite well, and I'll if you answer that, and then Stephanie.
Yeah, massively so. One of our biggest concerns is that whilst people have been shielded, they've not been accessing healthcare. They've not been getting their concerns about their health checked up through the NHS, and they've not been accessing some of the support that we've provided. So what we're now seeing, as people living with a terminal illness are starting to access care, we're seeing some real deterioration in health. We're seeing people who are coming to us in a far worse state than they would have done because they've just been too scared to let anybody through the door. So we're seeing an increased demand for services, but we're seeing some clear deterioration. I think one of the messages is that people really should ensure that they're accessing healthcare in the way that they were, to check those, lumps and symptoms that they're concerned about. And if they are living with a terminal disease, that they're not living with symptoms, they need to phone our 24/7 advice line. We will be there and we'll do what we can. But the deterioration is quite real.
Yeah, and I think that comes back to the confidence and the fear that people have had across the pandemic, isn't it? And it's vitally important on so many levels that people start to go back to what they would have done before, I think. And as you say, in your case as a charity, and in the areas you work, that's more important than ever. Yeah, Stephanie, to you, obviously, you I suppose work with people from a slightly different age range to a degree, as we said, in a young person's point of view. I suppose that, again, your changes are very much around that economic impact on families, perhaps, and how they can cope. So, again, give us your thoughts on it.
Yeah, absolutely. I think what we've really noticed with the pandemic is the first couple of weeks, people were okay, and then gradually, as we're getting into it further, as I said earlier, families are escalating to crisis. Once young people and families are escalating to crisis, of course, it needs a much more intense level of support to help them come through that. Young people, we're seeing massive amounts of anxiety, not just about the pandemic, particularly young people that are 16 to 18-year-olds. These young people have really been hit hard. These are the young people that should be getting apprenticeships. They should be going to college. They should, that this is still ongoing and it's going to continue. Young people that are 18 that should be moving on to jobs and employment. So there's going to be a massive impact on those young people. And I think that's probably every transitional age. I can hear your child there. Hearing their voice, absolutely. So yeah, the need is going to be escalating, and then it's just I think we're going to end up having to choose and prioritise who we're going to support, unfortunately, because we just don't have the capacity to support everybody.
Yeah, absolutely. No, that's interesting. Yes, and. Yeah, mine are okay at the moment, but they'll. It's a challenge we all face, and so different levels, I think, to say the least. Just the last wrap up, then, if I could. We're on 45 minutes. It's been a really interesting discussion, and I really appreciate Stephanie and Emma's time. So, Emma, I suppose from you first, and then Stephanie second. Perhaps give one positive you've seen out of this crisis from an organisation point of view, and the one main message to the delegates on the call as to how they can help.
Yeah, so I think one of the main positives is that digital means has brought teams closer together, if that makes sense, which is a bit of an oxymoron perhaps. So I think being able to get everybody in one place, albeit virtually, has been a real advantage. And I think seeing the warmth of the community continue to support us through this crisis, also people recognising we still need their backing, has been a big benefit. I think in terms of going forwards and for the audience, and I think as Stephanie said, is remember we're here. We're both here from a service point of view, but we're also here as a charity in the locality, needing support, doing the best that we can under very challenging circumstances. So if you think there's something that, even if you think it's crazy, some of the craziest ideas are often the best. Do get in touch. Whether it's something we can help you with some of the challenges in your organisations around loss or living with terminal illness, or supporting some of the challenges that we face, always happy to talk.
Okay, brilliant, Emma. Thank you. And Stephanie, your last few thoughts, to say a positive from you, and then a message to those on the call and other businesses in the area.
Yeah, I think a massive positive for us has been seeing how some of our young people have really risen to the challenge of pandemic. And when we're talking to them remotely, our young carers that are doing incredible jobs looking after single-handedly parents or family that are shielding. We've had some such impressive young people that we work with. So that's been quite humbling for us to see and to be part of their network of support. And yeah, I think absolutely, as Emma said, please champion our causes, champion these communities that were already disadvantaged, and there will be knock-on effects. And when you're talking to people, make them aware. I think we can all be very much stuck on our own little bubble, particularly at the moment. So for us, it's sharing the message of what is going on in our communities in Birmingham and Sutton Coldfield.
Brilliant. Thank you. Stephanie, Emma, thank you so much. It's been an absolute pleasure, and it really is quite humbling to hear the work you've done and you continue to do, and humbling to hear that you've still had the support of the local community, and obviously to stress that needs to be continued as we go forward. And as a chamber, we're obviously committed to helping publicise that where we can to our members and our businesses. Thanks all again. With this webinar will be up on YouTube for everyone to see. We'll do a few follow-ups in terms of some of the messages coming out of that. Thanks to everybody who was on board. Thank you so much, and we'll see you soon.